So, hello everyone. We are studying about neuro radiology. So, we are in the last class of neuro radiology. So, after that, we'll start in coming classes musculoskeletal radiology. Okay. So, this is the last class of radiology in neuro. So, here three things we'll discuss. One is CT angiography, and after that, we'll discuss about CT perforation, and another one thing is about thrombectomy because it is a part of stroke. So there's the reason I am explaining here. So basic things. Okay, for basic idea we have to know about these things, related things. So CT angiography. What is angiography? CT? So it is examination using X-rays to visualize blood flow in arterial and venous vessels throughout the body. Okay. Beams of X-ray are passed from a rotating device through the area of interest in the patient's body for several different angles to create cross-sectional images. Images are assembled by computer into three-dimensional picture. So basically, it is also a type of X-ray. So, but in that you have dye. Okay. So with that dye, we'll able to see all the images of arteries and veins, blood vessels mostly. Okay, visualization of blood vessels can be seen through this scan. So it is done to see the arteries and veins, mostly uh, heart region, brain region, okay, and as well as kidney. Okay, so wherever the problem occurs according to the condition, we have to see the blood flow to the particular part or particular organ, particular area. Okay, depend upon the condition of the patient. So this is CT angiography. So how it looks like? So we are discussing about neuro radiology, how the neuro CT angiography looks like. So we have two images. You can see this is the color image. So we're able to see all the arteries, mostly arteries of the brain. Okay, so it is aorta. Okay, aorta, carotid arteries are going. Okay, carotid artery, internal carotid artery, external carotid artery is this. It is here branches that will go into the brain: MCA, ACA, PCA. We have three main branches of the brain, that is MCA, mid cerebral artery; ACA, anterior cerebral artery; and PCA, posterior cerebral artery. So right side of the brain; left side supply, left side of the brain. So these are the main large vessels of the brain. Okay, other than that you can able to see. So these are the blood supply to the brain, very very important. Okay, now you can see another image that is black and white here. So this image also showing the blood supply of the brain. Okay, same posterior, anterior, middle cerebral artery, right side, left side. So this is the blood supply to the brain. So what happened? We already discussed in previous class. So due to the ischemic stroke, any embolism or thrombus, okay, atherosclerosis, anything can leads to blockage of those arteries. So you can see another image here, the blockage of artery in the brain. That is mostly this is MCA. You can see this here. You have the image. Okay, left side, right side of the brain here, left side of the brain. Okay, left side there is a blockage. So due to this blockage, the supply to the brain is reduced. Okay, supply is reduced. So this is CT angiography of the brain, how it's look like. If you want to see the blockage of arteries. Next is this is CT angiography. Very, very important. Next you have CT perforation. CT perforation. So let's discuss about CT perforation. So basically what happened that we already discussed, if a patient come after window period, okay, if a patient come after window period or after 6 hours, or he had wake up stroke. So if you want to know the actual damage part of the brain, okay, so to know the actual damage part of the brain, we have one scan that is called CT perforation. Okay. So if a patient come after window period, okay, or wake up stroke. So what it will give you the complete blood flow, complete blood volume. It will give two things: blood volume, how much amount of blood is going to supply that area, volume is going, okay, flow, how it is, how the flow is there. Is there a normal speed, a rapid speed, very little speed? So these two things, other things also will get, but I will explain these two things here, and it will give two things. One is penumbra, okay, and infarct core. Penumbra and infarct core. So let's discuss those two things here. So what perfusion will give? CT perfusion, or we'll call CTP. If a person come after window period or he had wake up stroke, these are the two criteria. So what will happen that you have to see CBF, complete blood flow, and CBV, complete blood volume, from flow and here volume. Flow means speed, here volume means how much amount of blood. So what happened whenever ischemic state occurs, if you assume this is a brain, okay, okay, if you assume this is the brain, so these are the gyre and sulcus. So what happened? MCA, anterior branch of MCA is affected. So you have in this MCA also you have three branches: anterior, middle, and posterior mid cerebral artery. AC is affected. So patient slept in normal condition. We will take the example of wake up stroke. Patient slept in normal condition. Okay, when he wake up, his leg is unable to move, hands unable to move, unable to talk, unable to speech. Okay, so when he went to the scan, he done. So he got ischemic stroke. Ischemic stroke. So if you want to know about how much amount of blood flow and blood volume is reduced that area, so we can do CT perforation. So what will happen? You will get two things here. In this, you will get two things. What is that? One is penumbra. and another one is infarct core. Infarct penumbra means it here your damaged area is that this is the damaged area. You can see that this is the damaged area. So the damaged area, the blood volume and blood flow both are reduced because of the clot. So what happened? So it have collateral blood supply. What happened? Brain has collateral blood supply. So it will get the blood supply from another sources, but the main artery is blocked. So what happened? You will get two things. One is penumbra and infarct core. Means the damaged area and the area which blood supply and blood flow is normal, but the area where blood supply and blood volume is decreased. So what we will call that area, you will get infarct core. So with the help of CT perforation, you will get both the things. So the area where blood supply you will get, but blood supply is here, blood flow is normal. Oh, no, sorry, blood volume is normal, blood flow is reduced because there is collateral, means collateral, the pressure is low. Okay, that is penumbra, means the area where the blood supply, blood flow, and blood volume is there, but blood flow is reduced. Infarct core, where that area is damaged, there is nothing blood supply, blood volume is also low, and blood flow is also reduced. Both are reduced. Flow is not there here. And in fact, in penumbra, volume is reduced, where volume is normal and flow is reduced. So this is the this thing you can have to see that in the CT perforation. So this image shows that things only. Okay. So which part is damaged? You can see this is the penumbra, the actual infarct core area. This area is having the this also red dots all, or you can see the penumbra, the actual uh, infarct core, and other parts having collateral blood flow and blood volume. Okay, so this will give that idea that person will recover or not, and what how much amount of brain is affected. So all you will get in that things. So this is the thing about CT perforation. Okay, so these are the things you will get in CT perforation. So next is you discussed about CT angiogram, okay, and CT perforation, and now we will talk about thrombectomy. So thrombectomy is the procedure to the blood clot happen. So it may be break by catheter or else mechanical. Mechanical means the it will broke into small pieces. In this you can having this is catheter, the aspiration will be done here. Here it will break into small pieces and removed. So, okay, this is mechanical thrombectomy. So this call will taken by neurosurgeons or neurologists. So for knowledge purpose I am telling her. So there are criterias also, so we are not discussing here. So this is one image in that post. This is called angiogram showing acute occlusion of right mid cerebral artery. So this is the mid cerebral artery right side. Okay. So occlusion, clot is there. Okay. So next is post thrombectomy. After thrombectomy, the angiogram is done and showing revascularization means again the vessels are functioning. Right mid cerebral artery. So you are getting right mid cerebral artery. So here thrombus removed. Here thrombus is removed. You can able to see this by thrombectomy in the within the vessels. Okay. So this is all about this is thrombectomy. So it is the neurosurgeon, neurophysicians call what they will do. Okay. So this is all about in neuroradiology. So in coming classes, we'll discuss muscle skeletal radiology. Okay. What are the important scans to be done, investigation of choice, and what are the pathologies in that you need some different types of scans and how to study those scans. So we'll discuss in coming classes. So here we completed neuroradiology. I hope you understood